Lauren, from what you study and with all your contacts at Johns Hopkins, are we out X number of months where so-and-so can't get on an airplane because they don't have an identification or proof of vaccination?
I think it's going to depend on what airplane they're trying to get on. So part of the challenge with these vaccination passports or with the proof of vaccine is that they're being rolled out all across the board in different ways. And that's one of the biggest challenges is we don't have a national or global strategy on how we communicate about these vaccines. I think in a lot of places you'll see just that, vaccine requirements, even before vaccines maybe are moved from emergency use authorization to approval. So what that rollout looks like could be totally dependent on where you are and who's asking.
Where do you, this came up a number of times yesterday, it is, let's call it middle of April. Where do you perceive will be middle of June?
I think here in the US, we're going to have many, many people vaccinated, and it's going to look like a different summer than it certainly did last year. I think we're seeing reopenings happening across the country. My concern really is that we need to hold on to these social distancing practices, the masking practices a bit longer as we see how the vaccines do against the variants, and we see how the summer looks after some of these states have already started their reopening strategies. I'm hopeful that we'll have a summer that is much more looking like a normal summer than we did last year.
I'm trying to get my hands around the actual data, what you said about the efficacy of the vaccines against some of the variants. I was reading some data saying that they were actually very effective, certainly the B117 variant as well as the South African one. Are you seeing different information?
No, I think that's right. I think everyone is hopeful that the vaccine data will hold up. We're just early in the process, and the variants are at really different levels depending on where you are in spreading in the community. And so we're waiting to see what the studies come out from the vaccine makers, because they're all working on this right now. But we're also seeing just the preliminary data from people who are vaccinated in the community. And so I think the hope is exactly what you're describing, is that those numbers maintain and the vaccines are still incredibly effective. Possibly we'll need boosters for some of them, depending on what happens with the variant spread, and possibly they'll work as is.
Yesterday, we were talking about an internal memo that was being circulated in the European Union, talking about how they were hoping member states, member nations would have enough vaccine to inoculate all adults by the end of June. This vaccine is AstraZeneca. What is the problem here with AstraZeneca and getting the confidence that it's necessary to get people to actually take it?
I think one of the big problems, honestly, has been the communication, and that's the communication from the company to the regulatory bodies and the communication about the findings. And so, we're hearing all these stories about weak data or about the varying levels of efficacy, but in the end, this is still a highly effective vaccine that has the potential to be readily accessible across the globe. And so there is this group that may be affected by the rare clotting outcomes that we've seen, particularly this younger population. I believe it's more affecting females. But that being said, for the rest of the especially vulnerable elder communities, this is still an incredibly safe and effective vaccine. I think everyone wants to see the final data set that's going to the regulatory bodies, and not just interim trial data or pooled data. And that's the key piece.
Lauren, everyone's talking about this, and I'm not going to mention any names on here, totally inappropriate for us as an amateur to do this, but does the public decide which vaccine they want? Are we to a point where, like all the drug advertising in America, unique to America, that somebody walks in and says, no, it's either this one or I'm not having it?
I think eventually we will be to a point where people can decide. Right now, we're not there. We're at a place where if vaccine is available, you get that vaccine. And that is the important thing is that the vaccine is available, and that all of the vaccines that we have coming down the pipe are incredibly effective. And I think that for a lot of us, that was a place we weren't even sure we were going to be at this point in time. So it's exciting to see that we have multiple options, especially we even have 1 and 2 dose options, and those 1 dose options can be great for reaching hard to reach populations. The key will be as we move away from this emergency phase and into sort of maintenance of protection, the way we do with flu and yellow fever and other required or readily available vaccines, that we understand the value proposition of these different type of vaccines, and we continue to investigate their ongoing efficacy and their ongoing safety beyond just this emergency phase.
How much do we know how much these vaccines prevent infection, not only prevent the illness itself or getting very ill, and how quickly do we know that they actually work? Do we have that data?
We have the data on how quickly they work to prevent severe disease and keeping people out of the hospital, which is the most important thing right now in this emergency. The data continue to roll in on how protective they are against transmission. I think we saw data recently from Pfizer that shows that it is highly effective against transmission. And so as we move into more and more people in the population getting vaccinated and still having exposure or contact with people who may have the disease, we'll start to see more data on whether or not these vaccines are across the board preventing transmission or if they're just preventing people from getting sick. But either way, they're keeping people out of the hospital, and that is huge right now.